Do all scoliosis braces offer the same results? Scoliosis involves the development of unnatural spinal curvature that also bends and twists into the concavity. A scoliosis brace is worn around the torso as part of scoliosis treatment, and this can be either rigid or a flexible brace. There are different types of braces. Just like there's different types of scoliosis treatment approaches, and these different types of braces are normally aligned with each type of approach. The most common type of brace used in traditional orthopedic treatment is something called a Boston brace. And the most common used brace in modern treatments are called corrective braces. And the brace system that I like to use is something called a ScoliBrace. A Boston brace in traditional treatment is just about holding a spine and hoping it doesn't worsen into become more severe, more into the surgical threshold, while modern bracing is more about correcting and reducing a scoliosis. Now, traditional bracing, like a Boston brace, works via a 3-point pressure system that applies a squeeze along certain points along the spinal curvature of the body. Boston braces are typically rigid, and the goal is just trying to slow down or stop progression. These Boston braces squeeze the spine into a straighter position, but this squeezing can have a negative effect. And one negative effect it can have is it can be known to weaken the spine and muscles. It can be known to increase rib deformity by causing this squeezing. It can cause the ribs to move more posterior, which can cause an increase in the rib deformity. We also know there's compliance issues with Boston braces because they're not completely customized. Meaning when you look at Boston braces, they almost look exactly the same, just the width is what's changing. And you can have patients with two different types of curvatures, and there's not a lot of difference when we look at the size or we look at the shape of the Boston brace. And we also know the way these braces are made, that they flatten the lumbar curve so it can make it difficult for patients to sit for a significant period of time the way they're designed. And we also know that since curves can worsen by wearing a Boston brace, that as the curve gets bigger, the brace gets less comfortable. And the result of this less comfort means that there tends to be more compliance issues. And since Boston braces are causing this squeeze effect, they don't really deal with the rotational components involved with scoliosis. And this rotational component is one of the key components in reducing and managing a scoliosis. Full-time bracing wear in a Boston brace can be up to 23 hours a day, and that can be period for the entire phase of growth. And for some kids, that can be up to 5 years, or when growth completely stops. When we look at a corrective brace or a ScoliBrace, we're looking at a brace that's ultra corrective. And the goal of this brace is to augment other types of treatments that are aiming towards corrective results, meaning trying to reduce the size of curvature on a structural level. ScoliBraces work not only by pushing the spine, but they work by realigning the spine in a biomechanical way and using biomechanical principles of the spine to help reduce the size of scoliosis and derotate the spine. ScoliBraces, corrective braces, represent the culmination of what we learned about bracing, and ScoliBraces really address a 3-dimensional component. What's unique about our brace system is that each brace is 100% customized. We're not limited by a Boston brace design, that we build whatever design that we need in order to deliver the very best results for the patient. And each one is built to suit each and every patient's body type, the curvature, where it's located, so it's less bulky, it's easier to wear, but most importantly, it provides better results. And when we get results with patients and patients start improving, the brace becomes more and more comfortable over time, not less and less comfortable like with Boston braces when curves worsen. Now, when we look at bracing, we know bracing for adults and children are very different. Now, when we look at traditional approaches, they normally would only brace children that are rapidly growing to try to stop progression. And we know since growth is what triggers progression, so the goal of traditional bracing is just trying to slow it down during this growth phase. However, for corrective bracing, we're applying these forces in children, not just trying to stop progression, but trying to reduce the curvature. And this is particularly effective on growing spines because the more they grow with a corrective brace during corrective treatment, we know we can have a more significant impact on the size of curvature. Now, adult patients that get bracing, there's really not an option in the traditional options because they're not progressing rapidly. So they hardly ever use bracing for the adult patient. For adult patients, we can use corrective bracing not only to help reduce the scoliosis, even though the amount of reduction that we can achieve is not as effective, not as much as we can get in a child, but we can also use it to improve pain and functional approaches in scoliosis cases. And we can also help elongate a spine, which is one of the key things when we look at adult patients, because adult patients are completely compressing as a result of their scoliosis over years, and this compression can lead to pain and discomfort, where with a good corrective brace, we can help elongate the patient, decompress the spine, and help the person improve what they're feeling, and especially when we augment this corrective brace with other types of therapies and rehabilitation. And like I said, that no brace on its own has the power to reduce or correct the scoliosis completely, but if we combine corrective bracing as a integrated piece in other types of approaches like chiropractic care, therapy, exercise, rehabilitation, and this is combined in a very significant way, corrective bracing can have a much more significant impact on managing and reducing a scoliosis than a traditional style brace that's just trying to squeeze it and slowing it down during growth phases. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.